All right, here's the deal. The trigeminal nerve is a game changer in medicine and electroacupuncture. When you know how to harness its power, you can deliver better results, faster pain relief, and improved overall health for your patients. In this training, I'll show you how to target key trigeminal nerve points like gallbladder 3 and stomach 7 for maximum impact. Then I'll teach you how to use advanced electroacupuncture techniques to charge and restore the teeth and the channels. And lastly, I'll answer the question of whether or not it's okay to combine trigeminal nerve stimulation with ear tooth points. I'm Dr. Jeremy, and my mission is to help acupuncturists like you achieve extraordinary results with cutting-edge electroacupuncture techniques. If you haven't subscribed yet, hit that button now so you don't miss out. And don't forget to download your free guide packed with everything you need to implement this today. Let's dive in.
Let's go over diagnosis. So diagnosis in the system is the same, but now we're focusing on dental. So step one to diagnosis, which acuchannel, neural level, or tissue is deficient? When we're talking about teeth, which acuchannel, because the acuchannels show in tooth deficiencies, and it's also diagnosing which tissue is deficient. That actual tooth tissue is deficient, right? When we talk about neural levels for dental, come in the chat section and tell me which cranial nerve are we most interested in diagnosing a deficiency and using for treatment? Which cranial nerve? Come in the chat section, let me know. Somebody says vagus. Any other guesses? Somebody says facial. Any other guesses? Somebody says trigeminal. So it's the trigeminal is what I was looking for. And there's a graphic to show you, if I can find it. Oh yeah, have you all been looking in your patient's mouth for those 4 dental issues this week? Yeah. Yes, yes indeed. How's that going? Now look at this. Jeannie says, great. Look at this. This is the trigeminal nerve. Look, it feeds all the bottom teeth. And look, another branch comes and feeds all the top teeth. The epineural covering of this nerve is highly electrically conductive. So it's a great place to fill up teeth with charge, right? How do we do that? Let's go deeper. Halfway between, here, let me show it like this. Halfway, you could see my little red pointer. Am I correct? Just let me know. Yes, okay. Halfway between gallbladder 1 and triple energizer 21 on an imaginary line, halfway about here is that, I think it's gallbladder 3, and then below the bone is stomach 7. I may have those reversed. I'm not sure, but one's stomach 7, one's gallbladder 3. You angle your needle in a V, right where I had that red dot there. There's this bone here, so you want your needle to go behind the bone. There's that bone. In blue here is the trigeminal ganglia. In blue. This is what we're accessing with either stomach 7 or gallbladder 3. And what you want to do is you want to select one. If the patient has a stomach channel issue or stomach tooth problem, then choose stomach 7. If they have a gallbladder channel or a gallbladder tooth issue, then choose gallbladder 3. Or you could just do both, but you're only allowed 4 needles. So then that gives 2 of your needles. Now this will send charge. One of those points will send charge on this ganglia and fill up the entire mouth all at once, which you may want to do. Okay, that's how we treat the trigeminal nerve. Now, there's a difference in effect from treating the trigeminal nerve and treating the ear tooth points. What's that difference? Well, yes, the trigeminal nerve will fill up all the teeth all at once, but it will get rid of some leaks in the teeth. But when you hone in on a teeth on the ear, you are getting rid of a lot of those leaks in a specific tooth and channel system with that one point. So the tooth ear points are better at getting rid of itchy leaks, and the trigeminal nerve is better at shotgunning electricity into all the teeth. Now you can get any peripheral nerve to trigger the release of beta endorphins, major painkiller, as well as some other neurotransmitters. How do you do that? Well, you just want to use a frequency between 1 to 5. You want to use light power with a high voltage machine, and you want it to go for 20 minutes, no longer than 30 minutes. Jeannie says, would you connect the trigeminal nerve point to the ear tooth? Yes, you can. That is totally legitimate. Now, yeah, that is totally legitimate. There's even a trigeminal nerve point on the ear. It gets rid of leaks in the trigeminal nerve. Should we pick a particular side? Yes. We're going to get more into that. Choose the side where where you're sure the deficient tooth is. For example, is there a root canal? Is it on the right? Is there mercury? Is it on the right? Is there impacted tooth? Is it on the left? So on and so forth. Or I told you could use 2 needles on one side. Why not just use 1 needle, but on both sides? You'll be getting the trigeminal nerve on both sides. Okay, let's go deeper into, so that is neural level for, diagnosis and treatment trigeminal nerve.
All right, what did you think? I'd love to hear your thoughts or answer any questions, so feel free to drop a comment below. And remember, I've put together a free downloadable guide with everything we covered today. Just check the link in the description, grab your copy, and start using this powerful information in your practice. If you enjoyed this episode, give it a thumbs up, and feel free to share it with colleagues who'd find it useful. And, as always, for more in-depth training and resources, head over to electroacupunctureinstitute.com. Thanks for tuning in, and I'll catch you in the next one.